Hi, and along with Keith, Kevin, and Katie, we are all the Rills. We own Your Medicare Solutions, and we are really excited to meet with you to talk about Medicare in an upcoming appointment. So the first thing you should, after you booked, you should have received an email that is asking you to complete a scope of appointment. That is a legal document that Medicare requires us to get once a year from every client to share pricing with you. That's all it is. So Katie sends that to you. It's emailed automatically. She can also text if you prefer, just so we have your signature. We're required to have that signature 48 hours before we meet with you. That way we can openly talk about prices for Advantage plans and supplements and drug plans and anything else that you want to know. So we wanted to give you some information before we meet. Some people have shared that they watched this video several times, and hopefully it helps our conversation when we get together and you have a little bit of working knowledge about how Medicare works and what's available to you. So this video is specifically for 2026. And the first thing I wanted to share is about Medicare Parts A and B. That is what is considered original Medicare. So typically, if you are turning 65 and you are not actively working, you will be required to enroll in Parts A and B, start your original Medicare. For those of you who are still working and you have at least 20 people that are full-time employees, you have the option to stay on your group employer plan and delay the start of Medicare. Or in some cases, some people may choose keep the group employer plan and just enroll in Part A, and we'll talk about why that is. So you have a lot of options, or again, you can make that full-on switch even if you're working full-time to Medicare. So the first part of Medicare is Medicare Part A. Part A deals with everything inpatient. So this would be inpatient hospitalization for physical health or mental health. This is also for skilled nursing facilities. Now, Medicare doesn't cover anything long-term, so there is no long-term care coverage. When we say skilled nursing, we mean a short-term rehab facility. So typically, you've been in the hospital at least 3 days, and you are stepping back to the skilled nursing before you go home, usually for intensive physical therapy, occupational therapy, things like that. Some home health services are covered under Part A, and also hospice is part of Part A. So your premium for most people is $0. And the reason being is that all those taxes, so if you or a spouse has worked at least 10 years of your lifetime contributing to those Medicare taxes, your premium for Part A is $0. That is why some people who choose to stay on their group employer plan when they're actively working will choose to only add Part A of Medicare because it's $0 monthly premium, and it will act as backup secondary to your group employer plan should you be hospitalized. The second part of original Medicare is Part B. And original Medicare Part B deals with everything outpatient. So a lot of people think doctor's appointments, primary care specialists. This is also if you're going to get labs or diagnostic tests done. This includes physical therapy, occupational therapy. This is all preventative medicine, so vaccines, as well as colonoscopies, mammograms, things like that are also part of the Part B. Durable medical equipment. So if you need some testing supplies because you're diabetic, or oxygen, a CPAP machine, even renting a hospital bed, that is all considered durable medical equipment. And another big one is Part B medications. So I always tell everybody, think needle or IV, because that is how medication is administered outpatient. So it could be as simple as a cortisone shot, but also as detailed or invasive as your chemotherapies, immunotherapy, things like that for cancer treatment. So Part B it does have a has a premium, and this year it is $202.90 per month. So that is the standard premium. Now, they do have different levels. So based upon your income, looking back 2 years, will depend if you pay the standard premium or if you have an adjusted premium because you earned more money in past years. So currently for 2026, someone filing taxes individually, your cap is $109,000 or less for income, and that's your adjusted gross income. It's formed from Form 1040, line 11. That's where you can find that number, and they're looking back currently at 2024. For those who file jointly, your max income to keep at the standard premium is $218,000 or less. So if you earned more than that in 2024, then you would have an adjusted premium. Now, just so you know, if you have a reduction in work hours or work stoppage, a retirement in 2026, you can submit paperwork to the local Social Security office. We can provide that to you. That says, yes, you had a higher income back in 2024, but now in 2026, because you have retired, you'll be under a certain threshold and they can adjust your premiums back to the standard $202.90. So the way original Medicare works, it's an 80% coverage. And there is no maximum out of pocket. So if you only had original Medicare, 80% of your medical bills would be covered. You would be responsible for the other 20%. And there are also some deductibles that go along with that. Most people don't stop with just original Medicare. They add on additional coverage, and that's where we come in to help you with that to determine what coverage is best for you. The other thing that is required, even though it's not part of original Medicare, is the Part D prescription drugs and having a plan for that. Even if you don't take any medications currently, you need to have a drug plan. It is required. And by starting a drug plan when you start Medicare, will help so that you don't get any of these penalties if you hear people talking about getting penalties for not having a drug plan. So you do need to have one of those. There are 3 stages, and this is the same across the United States. It doesn't matter where you live, what plan you go into. There are 3 stages of coverage. The first is the deductible stage. Some plans have a $0 deductible, and plans are allowed to go up to a $615 deductible. What most plans do, if you just take generic drugs or any of your generic drugs, most of them, even if you have a deductible, you don't have to pay it. It typically starts with those name brand, or we call tier 3 drugs, where if there's a deductible, you do have to pay that deductible before you move on to the co-pays or co-insurance for that, those medications. The second stage is the initial stage. This is where you're paying either a copay, a set dollar amount, and with generics, it's very common for them to be anywhere from a $0 copay up to a $5 copay, or a co-insurance, a percentage of the cost of your prescriptions. And typically we find those on those higher tiers, the more expensive drugs, the name brand drugs, tiers 3 through 5. The government has put a cap on the maximum amount you can pay for prescription drugs in a year when that drug is on the formulary. So every insurance company, it's all done through private insurance for drug plans, has a formulary of drugs that they cover. So the max this year is $2,100. So that's taking the deductible, if you had to pay that, plus all co-pays, co-insurances. If you get to $2,100, you move to the third stage of coverage, which is called the catastrophic stage. And during that time, you pay $0 for the rest of the year. So for someone who's taking an oral chemotherapy pill, they're capped at $2,100. If you take several tier threes, that could be $1,000 a month, $600 a month, you're capped. You do have a cap of $2,100, and that's individual. Everything with Medicare is individual. It's not done as a household. Once we've got original Medicare in place for you, that parts A and B, it then comes to decision time. You only have two choices. You can either go the Medicare Advantage plan route, or you can go the Medicare Supplement plan route. So I'm going to start with the Medicare Advantage because that is most like the insurance you probably had up to now. It is managed care and it is private insurance. So group employer plans are private insurance. Even if you are part of the state exchange, the Penny in Pennsylvania or ACA, for under 65 coverage when you don't have access to a group employer plan, that is still managed care. So the Medicare Advantage plans, we call this a Part C, and that means it includes 100% of your Part A, 100% of your Part B, and it can also include the Part D drug plan as well. It's an all-in-one plan. This one has a lower month-to-month cost over the alternative of the supplement, but it comes with higher risk because you're paying co-pays, or in a couple instances, co-insurances for all of your healthcare services. So these plans will either be a PPO, which gives you a little more flexibility over the HMO, where you have to stay in network. Now, if you are in Pennsylvania, and the reason I mention this is probably 90% of our clients are, and in South Central PA, we have very large networks for our Medicare Advantage plans. Many of them include WellSpan, UPMC, OSF, Penn State Hershey, Lancaster General, Hanover, Gettysburg, Holy Spirit, they're all in networks. So we've got some big networks that other parts of the country don't have. So with your PPO or HMO plan, you're paying co-pays as you use services. So set dollar amounts. And in two instances, for Part B drugs and durable medical equipment, you're paying a co-insurance, a percentage of the cost for those things. This will be administered through private insurance, meaning Highmark, Capital Blue, Aetna, Humana, United Healthcare. There's a lot of different options out there, but this actually replaces your original Medicare because the private insurance company is responsible for 100% of the coverage. Now, these Advantage plans, they do include many times, and in South Central PA, they all have some sort of dental, vision, and hearing coverage. So whatever that coverage is, you don't pay an additional premium for that. You just pay the co-pays or co-insurances as you use those services. They can also choose to include added benefits like gym memberships, if you've heard of Silver Sneakers. They can also give you so much credit on account, or in some cases, some insurance companies give you a separate card for over-the-counter shopping, where you can go into a store, and in some cases, you go online. So instead of going to Amazon.com, you go to the insurance company's site to do your shopping, check out, they send you whatever the dollar amount is free of charge for your over-the-counter items like Band-Aids, vitamins and supplements, toothbrushes, mouthwash, cold and cough medicine, bug spray, so things that are normally over-the-counter. Premiums for Advantage plans. Most people really like the premiums because currently the majority of premiums are still $0 a month. You do still have to pay your Part B, that $202.90 for that standard premium or your adjusted rate. And that gets paid to the insurance company. And that is part that covers a lot of the premium in many cases so that you don't have to pay an additional premium. So it can be $0. Some have like a $29 premium, a $49 premium, but do know that there are many $0 premiums. In addition, the Advantage plans take care of that Part A deductible and also the Part B deductible. So in many cases, it is a $0 deductible for these Advantage plans. Just like your group employer plans or your private health insurance for under 65, there is a maximum out-of-pocket. Currently, that number is $9,250 a year. It can most definitely be less. Most plans are less, having a $7,900 or closer to a $7,000 deductible. That's very reasonable to expect for a plan in 2026. But the cap, you cannot pay. So even if you're diagnosed with cancer, and that is the biggest risk, we'll talk about that. That is the biggest risk with an Advantage plan, because when you start to see some of these copays, you say, well, that's not a whole lot of money. How would I ever get to that $9,000 mark or my cap at that $7,900? Typically, it's cancer, because cancer, you're paying a percentage of your treatment. But even if they say, hey, it's $300,000 worth of treatment, you cannot pay more than your max out of pocket in a calendar year. So there is a cap, and every Advantage plan is slightly different. Also with Advantage plans, you are always guaranteed issue. What does that mean? That means they will never ask you about prescriptions you take, doctors you see, health diagnoses. If you want to be in an Advantage plan, you are in, and you can move freely from year to year, from plan to plan. So if you like the plan, it just continues on from year to year. If the company makes changes or if they terminate the plan, you can move freely to a different insurance company or even different plans within an insurance company during the annual enrollment period at the end of each calendar year. Because cancer is the biggest risk, we tell everyone you either need to be prepared to cover that max out of pocket for at least 2 years, because unfortunately cancer doesn't know when it's January and stops in December. So if treatment goes over 2 calendar years, you would be responsible for that max out of pocket. Or you can also add on a standalone cancer plan. Standalone cancer plans do have an additional cost. They run right around $15 a month for every $5,000 in coverage. Most people in our area, when they opt in to get a cancer plan, will get $15,000 of coverage. So they will pay about an additional $45 a month. Why $15,000? Well, again, being that the max out of pocket's right around that $7,000, $8,000 mark, that would cover 2 full years of all your medical bills. They would pay that out, the $15,000. You put that into your checking account, and then you use that money to pay for your cancer treatment rather than your personal savings. In order to qualify for a cancer plan, either you can never have had cancer or been in remission at least 5 years. And then they also ask 2 additional questions about having HIV or AIDS. If those are all no's, you qualify for a cancer plan, or again, in remission at least 5 years. The second option you have is, instead of going with the Medicare Advantage plan route, you can choose to go with the Medicare Supplement plan route. In this case, everything is standalone, meaning the government pays that first 80%. Remember, we talked about original Medicare Parts A and B, 80% is covered by the government payment for any health services. And then you add on a separate standalone supplement, and the job of that supplement through a private insurance company is to cover the other 20% that original Medicare leaves behind. That's how you get to 100% coverage. The supplements do cover the hospital deductible, and I know I haven't given you that price yet. It's over $1,700. The Advantage plan, it's covered in full. It is also covered by the supplement. However, there is a Part B deductible this year that the Advantage plans pay for, and the supplement plans, you do have to pay that. And that is $283 for the year. So if you choose the supplement route, the first time you do anything outpatient, going to the doctor, having lab work, having therapies, you would receive a bill for $283 to cover that Part B deductible, and then that deductible is fulfilled for the year. A big difference with supplements is that these are national plans, meaning this is not managed care. You can go to any doctor, any hospital nationwide. If they accept Medicare, they absolutely will take your supplement. So you don't have to worry about staying in a network of providers. You can go to whoever you like nationally. These supplements have letter names because a Plan G in Pennsylvania has to be identical to the Plan G in Florida, in California, and Michigan. They're all the same. Plan G is currently the Cadillac of health insurance in our country. And with the Plan G, by paying an additional monthly premium, and at the time I'm making this video in January of 2026, the average in our area is about $140 a month. Some plans are higher, some are lower. Many do adjustments come June. So that number might be a little higher if you're watching this later in 2026. But that's the average currently for a Plan G. By paying the $202.90 plus your additional Plan G premium, the trade-off is you have no copays or co-insurance. All your medical bills that are part of Part A and B are covered in full. With the supplements, you are given the first 6 months that you start your Part B. So if you're delaying your Part B, this doesn't start until you start your Part B. You have a 6-month window where you can choose any supplement you want. No medical questions asked. They have to assume you are healthy and they have to take you. After 6 months, that window closes. And what that means is you would have to go through full medical underwriting. It's not a physical where you go to the doctor's office. Every insurance company has a list of questions. They want to know every doctor you see, prescription you take, diagnosis you've had, surgeries you've had. They will look at everything. And after 6 months of having Part B, the insurance companies legally can deny you. So we tell everyone, if you're interested in the supplement, you want to start with that when you start your Part B for the very first time. Another very popular at this time supplement is a Plan N. There are only 3 differences between G and N, but the premiums for N can be anywhere from about $30 to $50 less per month than the typical Plan G. So here they are. Number 1, if you go to the doctor and you have a Plan N, they are allowed to charge you up to a $20 copay. Where G, it's covered in full. Number 2, if you go to the emergency room and they treat you and send you home, you're not admitted, you will get a $50 copay, have to pay that. Plan G, that's also covered. And number 3 is currently illegal in several states, and if they ever wanted to change it, they'd have to give you a brand new plan, and you'd be grandfathered in. But currently illegal in Pennsylvania, this will never happen here, is where doctors, so Part B, they call it excess charges. This is where doctors don't really love the Medicare assignment and they want to charge an extra 15%. Again, never will happen in hospitals. This is just Part B. So if the Medicare negotiated rate is $200 for that appointment, that doctor is allowed to charge an extra $30 because that's 15% above the allotted amount. Again, illegal in Pennsylvania, will never happen here. As a matter of fact, we have clients in several states, and at this point, no one has ever reported that they have gotten a charge for the excess charges. It could happen in other states, but never in Pennsylvania. After you've got that supplement, you decide you want that, the second part is we have to get you into a drug plan, because the supplements are only covering the 20% that original Medicare leaves behind for major medical. So we add on a drug plan, which does have another premium attached to it. Some plans are as low as less than $10. We have a couple plans. So depending on your meds, depends on the plan that we will need to look at for you, which is why we always ask you to complete that client information sheet several days before you meet with us, just like the scope of appointment, so that we can gather all the information from you, run it in our system, and be prepared when we meet with you to let you know which plans are going to best meet your personal needs. And then dental, vision, hearing. I didn't mention that yet, and that is because original Medicare doesn't touch it, therefore supplements don't cover it either. There are no standalone hearing plans. It can be included as part of some dental, but you can get standalone dental and vision coverage. It 100% depends on if your dentist is in network, if it makes sense to have dental coverage, or if you just pay cash. Currently in 2026, the average for dental and vision is about $55 a month. Of that, about $38 is dental. The remaining 17 or so is vision, and you can choose one or the other, both, or none of them. It's totally up to you if you want to have that additional coverage. So those are the options that you have with Medicare. And of course, there are many, many insurance companies. And that is our job to get prepped before we meet with you to let you know which of the plans out there and which of the companies may have the plans that best meet your personal needs. So when we get together, we will be prepared, if we have all your information, to share plan options with you. And answer any questions that you have. So we very much look forward to meeting with you, and we will